Hi, I'm Lana Schumacher. I'm the Chief of Thoracic Surgery at Tufts Medical Center, and I'm here to interview Dr. John Sadeghi, who is the winner this year of our CTSNet video competition. So we're going to discuss all the findings in this excellent video that he submitted. He is at Temple University finishing his CT fellowship in his last year. So welcome and thank you for joining. And again, congratulations. I wanted to start this discussion, this open discussion, really on kind of what was so interesting about this case that you thought, like, I really wanted to make this video and submit it, and why did you pick this case?
Well, first of all, thank you so much for speaking with me today and sharing my video. To jump right into it, this case was interesting to me because we had two approaches on the same patient. Neurogenic thoracic outlet syndrome over the years have had many different approaches, and not just neurogenic thoracic outlet syndrome, but all thoracic outlet syndromes. There's the supraclavicular approach, the infraclavicular approach, the axillary approach, and probably the newest one is the robotic approach. Each of these approaches have their advantages and disadvantages. So I thought this case was particularly interesting because we did the open supraclavicular approach and as well as the robotic approach.
And can you discuss, any challenges maybe you had during this case or learning experiences?
Yeah, I think as a trainee, doing the supraclavicular approach is almost few and far between. It's not too often that we get to do the neck dissection. I think for maybe 3-hole esophagectomies, we get a nice exposure there. Zenker diverticulums, we get a nice exposure. And then, of course, for cervical ribs, I think the challenge is as a trainee is identifying the nerves. That's kind of what I'm most nervous about, finding the phrenic, staying well away from the brachial plexus as well. And just really knowing the anatomy and the relationship of that cervical rib to those nerves and the muscle groups.
And what was the thought process in doing the combined approach when it was decided to do that?
Yeah, I think after reviewing this patient's particular scan and seeing where the cervical rib was in relation to the first rib, ideally we would have done it robotically, but we felt that we wouldn't be able to access the cervical rib robotically, that it would have been too much of a deep tunnel in a dangerous area to do it safely, and likely wouldn't have provided that much benefit to the patient. So that's why we did the combined approach.
Great. And, as a grader on all these excellent videos that were submitted, what, we really appreciated about this video, and I hope everyone does watch it, you really went through the complete workup of the patient from, the complete history and physical, showing the diagnostic maneuvers, via video. I thought that was an excellent example of working up these patients and really then showing what's important for next steps. So the Botox injection to the scaling muscles, the CT scan, all of the workup was very comprehensive. And then I thought you did an excellent job really highlighting all these things that you just mentioned, what nerves you need to look out for, and structures that you need to identify, port placement, instruments used. So, your editing of the video by showing, these vital structures, I thought was really key in making this an excellent presentation and why it was graded so high. So can you discuss, how did you go about editing this video? Like, what program did you use? How did you record it? All the things that kind of someone would want to replicate when they're doing one of these.
Well, thank you for your comments. And I think anybody can do this. I used my work phone. It's like an iPhone to record some of the videos and the pictures. I asked help from the OR staff to take some of the shots while I was scrubbed in. People are generally really helpful and want to participate. And then I use the video capture program that's kind of integral to the robotic system for all the robotic video. I saved all that video onto my computer and then used Adobe Premiere Pro. But really, any video editing software can kind of do the level of editing that I did. And, I think it's menacing at first to edit videos. There's a lot of features that you have to learn from scratch. But the learning curve is not too steep. I think actually using videos online to learn how to make videos to eventually publish online was the way I did it. And I think years of practice too. I started editing videos when I was a general surgery resident.
Okay.
So gradually over time, I slowly acquired tools. I think the biggest part is that you're condensing many hours of video down to very crystallized, digestible form of 5 minutes.
Right.
And I think that's kind of where the experience comes in, is to kind of get the key parts of a video distilled down.
Yeah, you definitely showed that nicely. I think, you highlighted each of the steps. It was very clear that you had gone through and picked and made sure that you had good video highlighting what you needed to highlight. Did you use the same Adobe Premiere Pro for like marking up the video as well, to label and whatnot?
Yeah, so all the features can be accessed through Premiere Pro. I'm not an expert at it by any means. The highlighting and text that I included into the video, I just Googled or on YouTube how to add text or how to add a highlight to a video, and then it just quickly shows you how to do it. So that's kind of how I went about doing those specific features. Some of the nice smooth video transitions, those are just automatic features of the software itself, and it kind of makes it for an easier viewing experience.
Were you able to narrate in that same Adobe Premiere Pro?
Yeah,
Okay.
so you can. So the first part of my video was just a PowerPoint presentation that I imported into the video, and I can kind of change the duration very easily. It's just dragging kind of bars around to increase the duration of a certain slide, and then I just kind of record my voice over that slide with my laptop.
Great. I mean, it did an excellent job. I did go through why we picked your video as a top winner. Do you have any questions on this whole process or comments that you want to add?
Yeah, I think I watched last year's winner's video before I made my video. I kind of gleaned from it that maybe the whole process is to really educate maybe other trainees or students or even attendees trying to learn a new procedure. So is there a general overview of things that you're looking for when you grade these videos?
Yes, I mean, basically, really that you are showing all the key points that need to be shown, that you've given the background, the workup, looking at and the way you've labeled the structures. So yes, if I were going to place, a medical student or, a surgery resident there, that they would be able to really learn the whole process of working up that patient to the completion of the surgery and the things that are vital to look for. And we thought that you had encompassed all of that in your video in a very just timely, concise fashion, with not belaboring certain points versus others. And the flow and cadence of getting those points across was really spot on.
That's great. Thank you.
Great. Well, thank you so much for taking the time to interview and discuss the makings. As a video editor myself, it's time consuming. So I appreciate all your tips as well.
Yeah, thank you so much for having me and sharing my work.
Great. Congratulations.
Thank you.